Well, many of us are working on New Year's resolutions to lose weight, but some go beyond diet and exercise to the extreme of bariatric surgery. And I'm joined now by Dr. Askew, a general surgeon at Brookwood Baptist Medical Center, specializing in bariatric surgery. The first question is, this isn't a surgery to take lightly.
No.
There's some things people really need to know going into it.
Absolutely.
What would you tell someone who's considering?
Okay, so it's a major process, number one. So we're still going to ask you to do all the things you would do on a diet, meaning eating healthier, drinking healthier, being active, plus we're going to put you through surgery. So first things first is what to expect coming into it. It's a process just getting to the surgery. So
this isn't a, gee, I don't want to diet, I just want to get surgery and be done with it.
Right, absolutely not.
Okay.
This is for patients that have tried dieting for many years. They've maybe had a little bit of success, lost 20, 30 pounds, can't keep it off though, keep putting it back on. And it's also for patients who have a lot of weight to lose. So we're talking about patients who have 100 pounds or more to lose, oftentimes have comorbid conditions like diabetes, hypertension, and so they need more help than just diet and exercise can provide for them.
Okay, so what should they expect from going through this surgery?
Okay. First thing is they come to seminars. That's where we always start. So patients are going to come hear a free session about all of the details of what is obesity, what are the treatment options outside of surgery, and what are we doing with the surgeries. Second step is they see me in the office. They're going to go through multiple steps with nutritionists, physical therapists, with our bariatric manager, all for education purposes. They're also going to make sure they have to have medical cardiac clearance. So it's a lot of steps getting there. Some of these are required by insurance. A lot of them are required by us as well, including mental psychiatric evaluations, which also make sure they're prepared for the changes that they're about to make.
So, and those changes, again, it's not just a, here's, you do the surgery and you're done with the weight and everything's rosy. Explain what it's like for people after having that surgery, as they recover, and then just as they maintain after that.
Okay, right. So when you have the surgery, we're actually altering the gastrointestinal tract. So whether you have a sleeve gastrectomy and we're taking out part of the stomach, or you have a gastric bypass and we're altering stomach and intestines, we are physically changing the way you eat and process food. So number one, you eat differently. You eat slowly. You chew your food well.
Smaller portions.
Smaller portions, very small portions, frequent meals, 5 to 6 meals a day rather than 3 meals a day. So it's a drastic change in lifestyle. Have to be committed. Avoid liquid calories right after surgery and for the rest of your life as much as possible, because that's where we get a lot of our sugar intake. So mechanically changing things. Have to eat different. It's very hard to slow down. People eat very fast. We don't chew our food well, so those are changes you have to make for the surgery. It's liquids right after surgery, mushy, then back to regular foods. Then long term is a whole nother step. That's eating healthy for the rest of your life, being active, exercising, making exercise a part of your routine. Sometimes we hate to talk about exercise. Some people hate the gym. You don't have to go to the gym to exercise. You can walk your dog, you can do Zumba class, you can go for a swim, all sorts of ways to be active.
Bottom line, though, this is a major lifestyle change.
Lifestyle
not
change.
to be taken lightly.
Absolutely not.